America's public health crossroads, vaccines, leadership, and the battle over trust. A nation's health on the line. America is no stranger to fierce debates over public health. From seatbelt laws to smoking bans, the government's role in protecting citizens has always been contested. But today the stakes are higher than ever. Childhood vaccine mandates are being dismantled in one of the nation's most populous states. The director of the Centers for Disease Control and Prevention is under fire, with more than 1,000 health officials demanding accountability. And Robert F. Kennedy Jr., a longtime vaccine skeptic turned political figure, is preparing to face a Senate hearing that could shape the country's health policies for years. What connects these developments is not just science or medicine, but the fundamental question of trust. Can Americans still believe in their public health institutions? Or are we witnessing the unraveling of a social contract that once safeguarded communities against deadly disease? Let us look at each one in turn. First, Florida's break with vaccine mandates. The flashpoint comes from Florida. State officials recently announced the end of childhood vaccine mandates, a move hailed by some as a victory for parental freedom, but condemned by others as a dangerous gamble with children's lives. Florida Surgeon General Joseph Ladapo went even further, comparing vaccine mandates to slavery, igniting national outrage. Why does it matter? For decades, childhood vaccination requirements for school entry have been one of the most effective public health policies in U.S. history. Diseases like measles, polio, and whooping cough were driven to historic lows because vaccination was not just encouraged, but required. Ending mandates doesn't ban vaccines. Parents can still choose them. But without requirements, vaccination rates almost certainly drop. And as history shows, when vaccination rates fall below certain thresholds, outbreaks follow. Measles in California in 2014, whooping cough in Washington state in 2012, and polio's re-emergence in New York in 2022 are sobering reminders. What are the larger stakes here? Florida's move could embolden other states to follow suit. If enough do, the U.S. risks reversing decades of progress in disease control. The consequences would not be confined to Florida's borders. In an interconnected nation, outbreaks spread fast. A child unvaccinated in Miami could fuel a measles resurgence in New York. Second, RFK Jr. and the CDC crisis. As Florida rewrites vaccine rules, the CDC faces its own storm. Robert F. Kennedy Jr., once known primarily as an environmental lawyer and now one of the nation's most prominent vaccine skeptics, holds a position of influence in the administration. His presence alone has unsettled health officials. This week, more than 1,000 doctors, scientists, and public health experts signed an open letter calling for Kennedy's resignation or removal, citing his history of spreading misinformation about vaccines and his combative relationship with the scientific community. What about the CDC's identity crisis? For decades, the CDC was regarded as the gold standard of public health leadership worldwide. During the Ebola outbreak, the Zika scare, and even the early months of COVID-19, global eyes turned to Atlanta for guidance. But in the years since, its credibility has been battered. Confusing communication during the pandemic, political interference in science, and leadership turnover have eroded public trust. Now, with Kennedy wielding influence, the very identity of the CDC is on trial. Is it still a science-based institution dedicated to protecting public health? Or is it drifting into political territory where ideology outweighs evidence? So why does accountability matter here? When the public no longer trusts the nation's top health agency, the entire system falters. People begin to doubt guidance not just on COVID or measles, but on everything from food safety to opioid policy. The open letter to remove Kennedy is about more than one man. It's about restoring the CDC's integrity before it's too late. Third, the Senate hearing, a national reckoning. All of this comes to a head in the US Senate. Lawmakers are preparing to hold hearings with RFK Jr. on his role, his views, and his impact on health policy. The hearing is expected to be fiery, with Democrats pressing on misinformation and Republicans defending his stance on health freedom. Is this just a symbolic battle? Senate hearings are often more theater than policy, but in this case, the symbolism is powerful. At stake is whether America continues to align its health policies with scientific consensus, or whether vaccine skepticism is formally legitimized at the highest levels of government. Public health experts warn that giving a platform to misinformation, even in the form of a Senate grilling, risks amplifying it. Yet ignoring the controversy would be equally damaging. The Senate faces a delicate balancing act: hold Kennedy accountable without inadvertently mainstreaming his narrative. Fourth, trust, freedom, and the American dilemma. When you strip away the politics, what remains is a fundamental dilemma. How should a free society balance individual choice with collective responsibility? Vaccines are unique because they are not just about personal protection. They are about protecting the community. The newborn too young to be vaccinated, the cancer patient with a suppressed immune system, the elderly neighbor whose body doesn't respond strongly to shots. Public health depends on shared action. But in today's polarized climate, shared action often feels like government overreach. Calls for freedom clash with calls for responsibility, and leaders like Ladapo and Kennedy are capitalizing on that tension. Fifth, what is the cost of eroded trust? The consequences of losing public trust in health institutions are not abstract. They are measured in lives. During the COVID-19 pandemic, surveys showed that counties with lower trust in the CDC had higher death rates. The lesson was clear: when people don't trust public health guidance, they don't follow it, and more people die. Now, as vaccine mandates crumble and leadership wavers, the US risks walking down the same path again. Outbreaks of preventable disease are not hypothetical. They are inevitable if vaccination rates fall. Hospitals that are already stretched thin by staff shortages and rising costs could face renewed surges. And the broader costs, missed school days, economic disruption, fear spreading through communities, ripple far beyond the health system. So, looking ahead, what's at stake? The next year will be decisive. If Florida's model spreads, if RFK Jr. retains influence at the CDC, and if the Senate fails to set boundaries around science and policy, America could enter a new era where public health is permanently politicized. Alternatively, this could be a turning point. The backlash against Florida's move, the open letters from health leaders, and the Senate's willingness to confront Kennedy all suggest that many Americans are not ready to abandon science just yet. The outcome depends on whether the country can rebuild trust, not just in vaccines, but in the institutions that deliver them. What can we conclude? A nation at risk, a choice to make. America's public health crossroads is not about one state, one official, or one hearing. It is about the country's collective future. Will the United States remain a nation where science guides policy, where children are protected from preventable diseases, and where institutions like the CD Care trusted to safeguard lives? Or will it slide into a future where ideology trumps evidence and preventable deaths become acceptable collateral damage? The choice is still ours, but time is running out.